May we please rise for the national anthem. My colleague Tom Sinime will help us.
Tribes and tongue may differ, in brotherhood we stand. Nigerians all and proud to serve our sovereign motherland. Our flag shall be our symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hand unto children a banner without stain. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed, and so in peace and plenty Nigeria may be blessed.
Thank you. Amen. Thank you. Thank you, Tom Sinime. I can assure you, she sings better than me. I speak better than I can sing. Once again, thank you, ladies and gentlemen, for being here. I am so excited and delighted to welcome you to this, wow, history-making event. I'm going to be your host today, and my name is Senami Ohiomohai. I'm glad to be here. I was talking to Dr. Miriam earlier and just bragging about the fact that I'm from Badagry in Lagos State. But don't ask me if I speak French. All right, ladies and gentlemen, I'd just like to recognize all of our wonderful dignitaries who are here today. I appreciate your presence. I'd like to start by recognizing the presence of the Honorable Minister of State for Agriculture and Food Security, who is ably represented here today by Mr. Aminu Oluwafisayo, who is the Special Assistant to the Honorable Minister of State for Agriculture. A round of applause for Mr. Aminu Oluwafisayo. Thank you very much, sir. Thank you for being here. I'd also like to recognize and appreciate the representative of the delegation of the European Union to the federal government of Nigeria, as well as ECOWAS. I know that Dr. Leila Ben Amor Mateo, Head of Human Development, is joining us online. A round of applause for her. I hope she can hear us. I'd also like to recognize a representative from the World Organization for Animal Health, the person of Dr. Simon Kivu, Program Officer, Veterinary Workforce Development. Dr. Kivu, did I see you? Okay. Thank you. Welcome, Dr. Kivu. It's good to have you here with us. Also from Dr. Miriam, of course, Dr. Miriam Mohammed, Executive Director, National Veterinary Research Institute in VOM. Ladies and gentlemen, a round of applause for the delightful and very warm Dr. Mohammed. It's good to have you here, ma'am. Thank you for being here. I'd also like to appreciate representative of the Chief Veterinary Officer of Nigeria in the person of, or represented by Dr. Yakubu Ago. Dr. Yakubu, where are you? A round of applause. Dr. Yakubu, why are you all the way at the back? Please move forward. Let's have you join us in front. A round of applause for him as he finds his way to the front. I'd also like to appreciate and acknowledge Arnold Bataille, Project Coordinator Lidiski. I met Arnold this morning, really very helpful. Thank you very much, Arnold, for everything, for coordinating. And I would like to also appreciate and welcome Dr. Sonia Darak, Regional Counselor for Agriculture, Embassy of France. A round of applause for Dr. Darak. I don't know if she's in the hall or on site, but we welcome you wherever you are, and we hope that you can hear us. Also help me acknowledge and welcome Sally Ibrahim, Project Manager, Food Security, Agriculture, and Rural Development Resilience and Regional ECOWAS. Sally Ibrahim, a round of applause. Is she here? Okay. I already welcome Dr. Kivu, Dr. Miriam, thank you for being here. I'm told AIG Aishatu Abubakar Baju, President, the Veterinary Council of Nigeria, is on her way. I don't know if she's here, but if she's not, let's hope she gets here soon with a round of applause. Or if she's down the hall, let her know that we're applauding her. And also, I'd like to welcome Guy Ilbodo. Forgive me if I messed up that one. Guy Ibodo, International Livestock Research Institute. A round of applause for Guy. So Guy, did I murder your name, or did I? Guy. Okay. Guy Ibodo. Thank you, Guy. Not Guy. Thank you. I told you don't ask me if I speak French. All right, ladies and gentlemen, help me also welcome Otto Muhunda from FAO, team lead of ECFAD. A round of applause for Otto. Thank you, Otto. Please come to the front seat. Thank you for being here. Ladies and gentlemen, I'm sure we all know why we're here this morning, but just in case, I'd like to just, welcome us officially to this event today. So, once again, a very good morning to you, guests, esteemed partners, ladies and gentlemen, and all attendees. A very warm welcome to you. It is a great honor to welcome you to the official closing meeting of the European Union Support to Livestock Disease Surveillance Knowledge Integration Lidiski project. Today, we are gathered here at this conference hall of Orphan Suit, Abuja, to celebrate the successful conclusion of a remarkable, or what has been a remarkable 5-year initiative, which is aimed at strengthening livestock disease. Now, the project has been in existence since 2000, I'm told. This project, founded by the European Union and implemented through a collaboration between the Federal Ministry of Agriculture and Food Security, the National Veterinary Research Institute, NVRI, and CIRAD of France, and also the IZSV of Italy and ICORE in Nigeria, has focused on addressing 2 critical diseases: pest des petits ruminants, that's PPRF, affecting small ruminants, and Newcastle diseases, ND, affecting poultry, both of which pose significant economic threats to livestock farmers in Nigeria. It is certainly a project that has achieved so much because through Lidiski, we've been able to work tirelessly to build stronger surveillance system, and also been able to develop strategies for better disease control. And today, the project team will share key findings, success stories, and insights from the past 5 years, as well as recommendations that can further enhance efforts to combat these diseases in Nigeria. So, ladies and gentlemen, I would like to thank you all for all the work you've done so far, the unwavering support that the teams have received, and dedication to this cause. And of course, today in this, as you participate, we hope that all the crucial work that has been done in securing a healthier, more sustainable future for Nigeria's livestock will come to bear. So, welcome, and let our conversations now begin. At this point, I'd like to invite for an opening remark and a welcome note, Dr. Mariam Mohammed, the CEO, National Veterinary Research Institute. Ladies and gentlemen, please put your hands together for Dr. Mariam for an opening address.
Honorable Minister of State for Agriculture, Senator Dr. Aliyu, ably represented by his Senior Special Assistant, Mr. Aminu Fisayo, Dr. Leila Ben Mateo, Head of Human Development of the EU in Nigeria and ECOWAS, Dr. Simon Kihu, Program Officer for Veterinary Workforce Development at the World Organization for Animal Health, Mr. Temitayo Omole, who has been a veritable partner from the EU, who is also currently online, all our Lidiski partners, our farmers from the 3 pilot states, our community animal health workers. It's a great pleasure, distinguished ladies and gentlemen, to stand before you today as we welcome the close of this important livestock animal disease surveillance project, which has been running by our partners for the past 5 years. This has been a truly collaborative effort, and I want to take this opportunity to thank each and every one of you for your dedication, your expertise, hard work over the course of this very engaging research initiative. Let me start by acknowledging and appreciating the efforts of all partners involved: the Federal Ministry of Agriculture and Food Security, the French Agricultural Research Center for International Development, CIRAD, the Italian Health Authority and Research Organization for Animal Health and Food Safety of Venezia, IZSVE, and ICORE, and the International Development Organization based here in Nigeria, and of course, the National Veterinary Research Institute. Thank you very much, everyone, for all the hard work that has gone into this project in the last 5 years. Our most appreciation will go to the European Union through the DESIRA Partnerships for Innovation, which has provided funding and support for critical for the implementation of this project. Also, like I mentioned, our livestock farmers around the 3 states who provided us access to their farms, to their animals, to collect samples, to continue to go back to them each time we need samples or to administer questionnaires. Importantly, I would like to thank the governments of Plateau, Bauchi, and Kano states through the State Directors of Veterinary Services for supporting this very instrumental and being collectively positive with allowing us to access all the farmers in their state. This project has strengthened my belief in the interdisciplinary collaboration and that forms the bedrock for future research and collaboration between the public, private sector, and international development partners. Like I said, the Lidiski project was launched in 2019 with implementation driven by a coalition of renowned institutions, as I have already mentioned, towards improving surveillance and control of 2 very critical animal diseases, which speak directly to the economic well-being of rural farmers. Peste de petit ruminant, known as PPR, of sheep and goats, and Newcastle disease, using Plateau, Bauchi, and Kano states as pilot. As you will see with all the presentations that will take place today during this closeout meeting, the project has brought out numerous evidence-based achievements to show for the 5 years of target-driven data collection and analysis, which were synthesized using modern information technology tools, which are also embracing high ethical standards for research, especially on disease surveillance. One of the most tangible outcomes of this project has been its positive effect on smallholder farmers. In a survey conducted during the project, 92 farmers were interviewed. An overwhelming 91 out of the 92 reported a noticeable increase in their income directly as a result of the control of these two diseases. The confirmed improvements in their overall livelihoods, attributing these changes to better disease control, access to vaccines, and improved animal health practices. These results reflect the project's success in translating scientific research into actionable solutions directly benefiting local communities. Some of them are here today, and we will give them an opportunity to speak about their experiences and what this has done in their lives. The project has also strengthened capacity for us through the training of veterinary staff. Specifically, we have been able to train 3 MSc students, 5 PhDs are ongoing and almost finished. 138 community animal health workers and 34 field veterinarians also received specialized training targeting surveillance of PPR and ND, but which we can copy for animal disease control across other diseases. A total so far of 18 publications have been published, contributing to the global body of knowledge on PPR and Newcastle disease. This has benefited us because it has generated recent data which the young scientists have produced. Additionally, we have had capacity building through 7 webinars, 4 conferences, 8 on-site trainings, and 9 virtual trainings for different categories of staff, not just MVRI staff, but staff from the Ministry of Agriculture and Food Security, from other partner research organizations, and the 3 states that we are using as pilot. Surveillance activities on PPR and Newcastle disease within these 3 states also showed that there were over 1,800 reports of PPR suspicion in small ruminants, 861 reports of Newcastle disease suspicion in poultry, which were reported directly by the community animal health workers trained under this project. The community animal health workers also provided support to 11,000 poultry and small ruminant holder farmers who now have better access to animal health care, support, and services. Progress was also made in targeting behavioral change through the dissemination of information to farmers towards early detection and control measures, which has helped to change the way local communities approach animal disease management. These were achieved by reaching over 500 villages and 502,000 smallholder farmers across the 3 states of Plateau, Bauchi, and Kano. We conducted 15 vaccination campaigns aimed at educating farmers on the importance of animal health, which has a direct impact on these livelihoods. With the global drive towards climate sustainable energy solutions, through the support of Lidiski, NVRI was able to install solar-powered system for maintaining cold chain and storage of vaccine seeds at the Institute's headquarters, the 3 pilot states, and an additional one in Yola and in our Katsina laboratories as well. So over the course of the project, we have been able to, because of this resource of the solar power at our outstation laboratories, been able to distribute almost 4 million doses of the PPR vaccines through these 3 pilot states, and almost 8 million doses of Newcastle disease. And if, thank you. And if I tell you where we were coming from, particularly for ND, at one point it was just 500,000 doses. And for 3 states, we have covered up to 8 million. So far, we have distributed 25 million doses of NDI2 vaccines through our other outstation laboratories, all because of the support of solar power and cold chain facility. The project has therefore expanded surveillance and early disease detection systems by also developing 31 new tools that our young scientists and field work has built capacity through an information system to support disease management, enhanced data collection and sharing, strengthened partnerships, and provided policy recommendations, some of which we will be talking about today. Furthermore, the rich data set collected on PPR and ND in the 3 states will continue to serve as a foundation for future surveillance efforts, policy developments, and research initiatives. The Lidiski project has truly contributed to efforts towards developing and sustaining national disease animal surveillance and reporting by providing those tools that are accessible and whose outcomes are verifiable. Data right now is available for 66 local government areas on the seroprevalence rates of PPR and ND. As at now, this is an output that can be used as a basis for control programs in Nigeria. I'd like to emphasize while closing that the Lidiski project has laid the groundwork for future surveillance and disease management efforts. The systems we have built together with our partners and the relationships that we have fostered will serve as the foundation for ongoing efforts to safeguard health of our rural livestock and protect food security, and also prevent the spread of zoonotic diseases. I would like to reiterate my heartfelt gratitude to everyone that was involved in this project. Your contributions have been invaluable, and the successes we have achieved is a direct result of the hard work and commitment of all partners. Together, we have not only achieved great things, but also set the stage for continued progress in the future. Let us continue to build together on the momentum that we have created. Thank you for listening. Thank you very much.
Thank you very much, Dr. Miriam. Ladies and gentlemen, please, another round of applause for Dr. Miriam. Because obviously a lot has been achieved, and it is worthy of not just notes, but mention, and it is something that we should be proud of. So thank you for all the work that has gone into it. I'm told that the Registrar Veterinary Council of Nigeria, Dr. Dotun Fadipe, is here. Dr. Fadipe, welcome. A round of applause for him. Please, could you please make your way to the front? A round of applause. Thank you very much. Dr. Fadipe. The next speaker is going to be joining us online. I need to make sure that the media team, if Dr. Leila is ready, let's know if we can hear her and we're ready to receive her own opening remarks. Dr. Leila is from the delegation of the European Union to the Federal Republic of Nigeria and ECOWAS.
Can you hear me?
Yes, we can. Ladies and
Excellent.
gentlemen,
Excellent.
a round of applause for Dr.
The-
Mateo.
Thank you so much. Thank you. I must begin by sincerely apologizing on behalf of Professor Leila Benamo Mateo, who would have loved to present this speech directly by herself in person. Unfortunately, due to some unforeseen circumstances, she's been asked to attend to some emergencies here in Nigeria, and she's not able to present the speech. So the voice you're hearing is the voice of Temitayo Omole, but the speech is that of Professor Leila Matthew, the team leader, Human Development Department responsible for the management of the Lidiski project, as you have been informed. I read the speech. The Honorable Minister of State for Agriculture, the Chief Executive Officer of National Veterinary Research Institute, Dr. Mariam Muhammad, distinguished participants, ladies and gentlemen, good morning. It is indeed a pleasure to be part of this gathering today online, and I should begin by appreciating everyone present for this important closeout event. It is slightly under 5 years ago that we signed and started implementation of the EU support to livestock disease surveillance knowledge integration, otherwise called Lidiski. The purpose of the intervention has been to support the Nigerian government in its efforts at combating animal diseases affecting the economic well-being of herders and farmers in rural communities. The idea behind the program was to take science to the field, increase capacity of the institutions of government responsible for fighting animal diseases and other infections. In this case, the National Veterinary Research Institute, NVRI, became our primary interlocutor, while the economic dimension of the program was anchored by a Nigerian entity called ICORE. The multi-party partnership for the purpose of the implementation of the program has been commendable, and we thank you all for the positive, collaborative work that you have done so far to deliver the impressive results we're about to listen to this morning. Although the project is coming to an end soon, this is by no means the end of the European Union engagement in strengthening the capacity of Nigeria and indeed nation states within ECOWAS to take full control in dealing with animal health and animal diseases that may occasionally emerge and eradicate them completely. Our recent visit to NVRI VOM threw up a number of significant factors that we need to pay attention to in future design, including energy particularly. We will definitely take this into consideration for future design indeed. I take this opportunity to reiterate that the European Union and its member states continue to be a reliable and dependable partner in helping, supporting, and facilitating steps to overcome social, economic, and technical problems. It is our sincere hope that the various government entities present here today, including those who have been part of the implementation of this intervention, would go away with the needed impetus to translate our broad reflections and lessons into actionable policies backed by budgetary, technical, and human support to deliver the full objectives of completely and totally eradicating Newcastle disease and pest petit ruminant in Nigeria and the region as a whole. In closing, we thank the National Veterinary Research Institute of Nigeria, CIRAD, ICORE, and all the consortium partners who participated in the implementation of the program. We thank the leadership of NVRI and the team that strongly supported and managed the processes of the intervention even during the period of COVID-19 and other challenges that happened along the way. On behalf of the European Union delegation to Nigeria and ECOWAS, I thank you very much and wish you success in the future. Thank you and good morning. I will stay online to continue to monitor proceeding in this regard. Thank you.
By all means, please do stay online. A round of applause for him. And thank you for stepping in for Dr. Leila. At this point, I'd like to invite for his remark from the World Organization for Animal Health, Dr. Simon Kihu, Program Officer, Veterinary Workforce Development. Ladies and gentlemen, please put your hands together for Dr. Kihu as he comes.
Thank you very much. The Honorable Minister of the States for Agriculture and Food Security, ably represented by Mr. Aminu Oluwafisayo, Dr. Reira Benamul Matthew, Delegation of European Union to the Federal Republic of Nigeria and ECOWAS, the OA Delegate to Nigeria, Dr. Korumba Bakulu, Dr. Miliam Mohammed, Chief Executive Officer, National Veterinary Research Institutes, Dr. Arnold Batel and the team from CIRAD, Ms. Oenevu Ogbobo and team from ICOLE, dignitaries, distinguished guests, colleagues, ladies and gentlemen. Good morning. It's a great pleasure to be with you. My name is Simon Kehu, and on behalf of World Organization for Animal Health, Regional Representative for Africa, Dr. Kalim Tonkara, I would like to convey the best wishes from the World Organization for Animal Health Director General, Dr. Emmanuel Sobilan. As you know, World Organization for Animal Health is a unique intergovernmental organization working with its members and partners to create a healthier and safer planet. It is built on international consensus, on the principles of good governance and quality of veterinary services as embodied in its international standards, which are recognized by the World Trade Organization as a reference for trade. Therefore, World Organization for Animal Health recognizes national veterinary services as a global public good requiring sustainable attention and investments. In this regard, OA works with its members to ensure that they have the tools, capacities, and support they need to keep their veterinary services to respond to the animal disease threats. Key to our objectives is controlling and eradicating animal diseases, and this is directly related to preserving vulnerable populations' livelihood, poverty reduction, economic support, and protection of the international trade. From this perspective, we recognize the eradication of rinderpest in 2011 as a major milestone that provided the impetus to engage in the second livestock disease eradication, the peste di petit ruminant, PPR, one of the devastating viral diseases of the small stock, which is spread and very widespread in Africa, Asia, and Middle East, and pose a great threat to sheep and goat, livestock trade, as well as the conservation of susceptible wildlife species. To this end, in their joint PPL control and eradication strategy, FAO and OA have set goal of eradicating PPL by 2030. And the first phase of the PPL global eradication program from 2017 to 2021 focused on PPL control. Now, the second phase, known as the PPL Global Eradication Program Phase 2 blueprint, commenced in 2023 and emphasizes on PPL eradication activities. OA is committed to implementing the strategy, which remains at the top of our international agenda. Ladies and gentlemen, this week, we are here to discuss results of the scientific research to inform disease control and eradication. As you know, OA fosters scientific excellence, independence, transparency, solidarity, partnership in an environment that delivers good governance. OA science system leverages science as its scientific network to ensure that its recommendation and technical outputs are based on the latest science aligned with the best practices. The OA reference and collaborating centers, as well as laboratories, constitute the core of this World Organization for Animal Health scientific expertise and excellence. Two of these institutions, CIRAD and IZSVE, have been working with the Nigerian Federal Ministry of Agriculture, as well as for food security, as well as with the National Veterinary Research Institute and ICORE, the International Development Organization in Nigeria, to implement the European Union Support to Livestock Disease Surveillance Knowledge Integration Lidiski project. Having been reasoning to the output of the project, I have a strong conviction that the results of Lidiski project will enhance Nigeria progress in eradicating PPL and controlling Newcastle disease, which are the key focus of this research. To conclude, I want to reiterate the federal government of Nigeria's well-recognized commitment to eradicating PPL and controlling other important livestock diseases. I invite you to reaffirm this commitment by prioritizing workforce development, as it has been done in this project, developing concrete disease control strategies, and producing vaccines to combat livestock disease menace. I wish you a very fruitful discussion during this close-up meeting. Thank you very much.